Hi friends, today we are going to discuss regarding one interest topic. The topic name is why the diabetic foot ulcers will take too much time to heal completely well. You all are maybe if you are in medical professional, you can see that there is a lot of patients came to hospital with the diabetic ulcers. They have the ulcers duration is very long period. So there are some factors affecting the healing process of who have the diabetes mellitus. So today I am going to share the what are the factors affect the wound healing process in the diabetic mellitus patients. First is there poor circulation. Circulation is very essential for the wound healing. Circulation in the sense that the wound have the less circulation, less circulated blood. The blood contains rich nutrients, oxygens, and so many components. So the wound is required so much amount of proteins, micronutrients, and so many things. So this everything the wound get via the circulation only. So the diabetic patients get poor circulations, it will be affect the wound healing process. It will take too much time to heal very well. The next thing is the neuropathy. Neuropathy means there is a nerve problem, loss of sensation in the lower feet, loss of sensation. So if the diabetic patient has neuropathy, if they hit anywhere, if they get any minor injury, they won't feel any pain, anything until it gets severe. Once it's get very severe, once it get inflamed, then only they came to know about okay, our foot got some injury or something. So that is also one of the reasons. If we treat any wound in the initial stage, definitely we can cure very well. So in the diabetic patient, due to the neuropathy, they will later only they understand, they can recognize the injury. This is the second factor. Third factor is the high blood sugar levels. High blood sugar level is one of the important component. It's mainly affect healing process and the inflammatory process also. So what happens whenever the patient get the high blood sugars levels, the high blood sugar level is it's a very creative, it's a very how to say, it's a very likely environment to grow the all organisms, more bacteria and some bacteria and all the wound infective organisms. So next thing is the high blood sugar level will inhibit the WBC functions. WBC means white blood cells. White blood cells is a very important role to fight against the infection. So the high blood sugar levels will reduce the function of the WBC. It will lead to the infections. So the high blood sugar level also one of the main component for the delayed wound healing process. The next thing is the infections. Infection is the above mentioned the four regions. The diabetic wound is very prone to get the so many infections. So due to the infections, the wound will get the wound healing time will take too longer. The next thing is the impaired immune systems. The diabetes is affect the patient's immune systems. So immune system is not working very well. So there is a lot of opportunity infections will come. It will also contribute to delay the wound healing process. The last thing is that the sixth factor is the pressure. Pressure means most often the patients get the diabetic ulcer in the pressured area. When in our foot there is a lot of pressure points. The patients get the ulcer in the pressure point. So the doctor suggests the patient to take the bed rest, but they are moving out of the bed for the day-to-day activity or day activity of daily living. For the time they are putting the more pressure in that ulcer area. So it will worsen the wound edges and worsen the newly formed epithelial cells. So the pressure also it will contribute to delay the wound healing process. So for these six factors, it's definitely we can consider while treating the diabetic ulcers. So if you see any patient with the diabetic ulcers, please suggest them to follow the aware about the six factors and provide the treatment and advice appropriately according to the six factors. Definitely they can get cure soon well. Thank you so much.